Hey everyone, my name is Siddharth and I'm a medical intern here in India. Currently, I've passed the USMLE Step 1 exam, and in this series, I'm going to be solving USMLE Step 1 style questions so that you can see the thought process behind how to solve a USMLE Step 1 question. And currently, this is the hematology section. You can check out the previous video on the hematology question. And yeah, let's go. Which of the following is the most likely underlying cause of this patient's abnormal lab findings? So they've already given us the finding lab findings are abnormal, and which is that her BMI is 25, which is normal. Her hemoglobin is 8.5, which is less than normal, and peripheral blood smear shows pale microcytic erythrocytes. Okay, so microcytic erythrocytes are mostly caused in this woman by iron deficiency or any type of blood loss. So, for getting to an answer, we're going to have to read the whole question, which is a 59-year-old woman comes to the office due to progressive fatigue and occasional heart palpitations over the last 6 months. These are features of anemia, and the patient has been under a lot of stress recently due to work, and she has no dietary restrictions, eats outside at restaurants frequently, drinks 2 to 3 cans of beer on the weekends. The patient is postmenopausal and has not noticed any uterine bleeding, dark stools, or bleeding with bowel movements. Okay, so the first option is drug abuse, and drug abuse is not really related to microcytic anemia. So I'm going to put a question mark on that for just a minute and look at the other options. Hematological malignancies will mostly cause normocytic anemia, so that can be ruled out. Hemolysis will cause either spirocytes or schistocytes or something might have been present on the peripheral blood smear, but none of that is present. And the next question is liver disease, which is a chronic disease, so that would not cause microcytic, it would rather cause normocytic anemia. Occurred blood loss, the patient has not noticed any dark stools or bleeding with bowel movements. So occurred blood loss is definitely a possibility because the patient cannot see the loss by her naked eyes. And poor nutrition. They've mentioned that she eats out frequently at restaurants, but she does not have any dietary restrictions, so B12 deficiency is out of question. She is more postmenopausal, so her iron intake would be normal and losses would be less. Occult blood loss is kind of the only option that I see fit here for this question, and I can explain it with microcytic erythrocytes because of iron loss, and the patient has not noticed any dark stools or bleeding with bowel movements. Also, her BMI is normal, so poor nutrition is out of question. And drug abuse is not really related with microcytic anemia, so I'm going to rule that out. And yeah, that's it for this video. I hope you guys learned a little bit on how to solve a USMLE Step 1 question, and subscribe for more videos, and I'll see you guys in the next one.